Welcome back. This is LAWSON ASP Med Simplified Hub, where we turn confusions into clarity. Today, we are going to be looking at what? Beta adrenergic blockers. I would just want you to know your beta blockers and what they do. Now, we have three beta receptors in our body. We have the beta1 receptor, beta2 receptor, and the beta3 receptor. But our focus will be on the first two, beta1 and beta2. So now, beta1 receptor, where can we find beta1 receptor? Beta1 receptor can be found in the heart. So the heart. And the kidney. The kidney. So someone is saying. The beta2 receptor, where can we find the beta2 receptor? We can find the beta2 receptor, one, in the peripheral vessels. So your blood vessels at the extremities. We can also find it in the bronchi. And we can also find it in the uterus. Now, beta3 receptors. Where can we find beta3 receptors? We can find it in the adipose tissue. And then we can also find it in the bladder, urinary bladder, for sure. Now, our focus will be on what? Beta1 and beta2 receptors. Now, the beta1 receptor found in the heart is found mainly in the sinoatrial node and the AV node. So, the one found in the heart is found in the SA node and the AV node, something like that. What do? They cause the release of what? Catecholamine. Like the catecholamine is act on those receptors, like epinephrine and norepinephrine. They act on those receptors, and then when they act on those receptors, they cause our heart rate to what? To spike. So they are responsible for what? Our sympathetic nervous response, fight and flight actions. Okay. Now, when we block these receptors using drugs like what's the name? Atenolol. So that's beta1 blockers. Atenolol, metoprolol, and then what's the name? Bisoprolol. When we block these receptors using this drug, what happens? We lower the heart contractility, we lower the heart rate. So one of the side effects of using this drug is that it can cause what? Bradycardia. Because it's lowering your heart rate. You can lower it beyond what's normal, which is what? Bradycardia. We'll not talk about the kidney, we are focusing on the heart right now. Now, when it comes to the beta2 receptors, they are found in the peripheral vessels, our what's the name? Extremities, the vessels at our extremities, the smaller capillary arterioles and all the other stuff. And then it is found in our bronchi. Now, in the bronchi, what do? These receptors, when they are activated by endogenous substances, what happens is that when they are activated, they lead to bronchodilation. They lead to what? Bronchodilation. So now, if we come and give a patient non-selective beta blockers, these beta blockers, they block both beta1 and beta2 receptors. When we give a patient this kind of drug, like carvedilol, like propranolol, when we give a patient this kind of drug, what these drugs does is that they can go to the bronchi and cause bronchoconstriction, which is going to be a side effect. That's why patients suffering from asthma or COPD are not given beta2 receptor, what's the name? Non-selective beta blockers. because it will contradict the purpose we are giving the drug for. So, in all, what I want to tell you is that beta-1 blockers are also known as what? Cardio selective beta blockers. And then what they do is they go straight to the heart destination node, they block the receptors there, causing epinephrine and non-epinephrine not to what? Activate the receptors, thereby lowering our heart rate. The same applies to uh, beta-2 receptor blockers or the non-selective one. This one, they can go to the peripheral vessels. When they go to peripheral, they reduce insulin sensitivity. So that's one of the side effects of what? Non-selective beta blockers. They reduce insulin sensitivity, and then by so doing, the glucose will remain in our body, and then it will not be picked up into the cells in order for energy to be produced. If you like this initiative, make sure you like, subscribe, comment. Make sure you understand, do not what? Memorize. Thank you for watching.